How does external beam radiation adapt to patient movement? Imagine trying to hit a moving target with a laser beam. That's similar to what happens during external beam radiation therapy for colorectal cancer. The body isn't still, especially in the abdomen where organs shift with breathing, digestion, and even slight changes in position. To make sure the radiation hits only the tumor and spares healthy tissue, advanced techniques are used to adapt to these movements. One key method is motion monitoring and real-time tracking. Special systems can detect the tumor's position during treatment by using external surface imaging or tiny markers placed near the tumor. If the tumor moves beyond a set limit, the system can pause the radiation beam or adjust it instantly. This way, the radiation stays focused on the target, reducing unnecessary exposure to healthy tissues. Respiratory gating is another technique especially useful for tumors in the abdomen. It works by monitoring the patient's breathing with sensors or surface imaging. The radiation is then delivered only during specific parts of the breathing cycle when the tumor is in the right spot. This synchronization helps improve precision and limits radiation to nearby organs like the bowel or liver. Adaptive radiotherapy takes things a step further. It involves taking new images during the course of treatment to see how the tumor or body is changing. If the tumor shrinks or shifts, the treatment plan can be modified accordingly. This ensures the radiation continues to target the tumor accurately, even as the body changes over time. Advanced imaging techniques like four-dimensional computed tomography are also used before treatment begins. These scans capture how the tumor moves over time, allowing clinicians to design plans that account for this motion. This precise planning helps deliver radiation more effectively and safely. Modern radiation therapy also uses beam modulation techniques like intensity-modulated radiation therapy. Instead of using large uniform beams, this method uses many small beams with varying intensities to conform closely to the tumor's shape. When combined with margin reduction strategies, it helps minimize radiation to healthy tissues, even if the tumor moves slightly. In the context of colorectal cancer, these adaptive strategies are especially important because the colon and nearby organs can shift with digestion and breathing. Using these techniques helps ensure the radiation hits the tumor accurately, maximizing treatment effectiveness while protecting healthy bowel tissue and other organs. Overall, external beam radiation adapts to patient movement through a combination of real-time tracking, breathing synchronization, adaptive planning, advanced imaging, and precise beam shaping. These tools work together to keep the treatment focused, safe, and effective throughout the entire course. If you or someone you know is considering radiation therapy for colorectal cancer, it's important to discuss these options with a healthcare professional to understand how they can be tailored to individual needs.